Okay, very cool. Alrighty, so I did receive your intake form and I did obviously review that. And so I have a pretty good idea of where I want to go with you, but of course, we have to make sure that we're on the same page. So why don't you start by kind of explaining a little bit more about yourself and why you called us today?
Well, the reason why I called you guys is because I've been struggling with weight loss. I've always had a problem with it. And I guess my biggest problem is my cravings and indulging in sweet things um and a lot of binge eating. And I'm just to the point where I'm getting older, my kids are getting older, I'm not having any more kids, and I want to live a healthier lifestyle and I want to lose weight because I see myself in pictures and I can't believe how big I've made myself get. I'm
Right.
losing confidence in myself. So I definitely want to work on, like I said, getting healthier and losing weight, and just overall, I think it'll definitely make me a lot more happier and more comfortable in my skin.
Yeah, absolutely. And just of course, yeah, being a mother and setting that example. I mean, it's so important. It's one of the main things that why we do what we do, right? Because it's kind of like that domino effect for sure.
Yes.
How did you hear about us?
I actually looked you guys up on the internet.
Okay. So just kind of Google search.
Yeah, because I was thinking of going through my doctor, but then I'm like, I kind of want to go through somebody that's personalized and knows what they're doing and what they're talking about and what they could recommend for me.
Good choice. Good
Yes.
choice. Okay, very cool. So I'm just going to tell you a little bit more about, and you probably went on our website, but I'll kind of just high level explain our approach to weight loss. And then I'm kind of going to go to a program that I think is going to be the best fit for you. But of course, if that doesn't seem to align with you, then we'll kind of go elsewhere. But
Okay.
you can see because you can see my screen, right?
Yes.
Okay, cool. So we have a number of different weight loss programs. We have a number of different like reset type of detox programs. Go deeper. So Weight Loss MD is all about looking deeper into the foundation, looking into the reasons of why we have the issues, not just treating the symptoms so we can, have like more of a short-term resolution. We have to get to the core. And oftentimes we do need to do some additional testing, and the testing is not anything that would be done at like when you see a primary care physician or anything like that. So we dig deeper into like gut health, food sensitivities, hormone imbalances, things like that. So I'm going to of course go a little bit in more detail, but I kind of just wanted to explain this section. And then we have a VIP program. This is a 3-month program, and this really encompasses all the different aspects of health. So when you just with me kind of introducing some of these categories, do you feel like, what do you feel is like the area that we need to go to first?
Um, I guess to go deeper, I need to figure out what's causing me to not lose weight, because there's been so many times that I've tried to diet in the past, like changing my eating habits, exercising more, and I'm just worried that it might be something that, I mean, I can't individually fix on my own. I know when I was trying to get pregnant with my first daughter, I had a lot of problems with insulin resistance. And that was a problem with me trying to lose weight. So once I started taking some of those, it helped. So I don't know
Yeah.
if there's some kind of chemical imbalance in my body that's like making me struggle to try and lose weight and get
Oh,
healthier.
absolutely. And if you have insulin resistance, it absolutely is very, very difficult to lose weight. So you're exactly right. I'll just kind of go into some of our testing, but what I'm going to go to first is our VIP, because it kind of incorporates all of the main components. But when we're looking at the whole picture, we're evaluating. Our main priorities are really looking at the gut. Food sensitivities, I mean, is so important because food now has become such a problem, not only the way it's made and processed and full of chemicals and really, poisonous for the most part, but it now is a problem because our guts have been injured from so many different reasons. Our gut takes the brunt of so much. And so now food, even though it is horrible, even good food can be problematic because you're basically asking an injured organ to do what it's really not capable of doing anymore. So we do
Right.
look really deep into those types of things because when the body is out of balance, I mean, I talk about this all the time. When the body's out of balance, it will literally never take you to a place where lowering calories and exercising more works. So it is all about that rebalance. So we're typically focusing on like gut health first. Some people like to do multiple testing at first, but this just to give you kind of an idea with what the gut test is. It's really for people who have been struggling with digestive issues. I mean, because gut issues can be migraines, it can be literally any symptom. It could be a gut issue, but a lot of people think this when we talk gut, like constipation, diarrhea, bloating, brain fog, cognitive issues. The gut and the brain are one unit. They are connected. So what happens in one happens to the other. Environmental sensitivities, asthma, difficulty breathing, food sensitivities, etc. So it's just, kind of giving you a snapshot of like who would be a good candidate. Do you have any questions about this this test in general?
I don't, but I think that could be playing into my issues too, because I do get a lot of like bowel movements, especially even after I eat. And I actually drink a lot of coffee too. So I don't know if that plays into that, but then I get a lot of gas and bloating associated with it as well.
Yeah, so there's something going on without a doubt. So it's not kind of like, I wonder if there's something going on, like there's something going on because that's not normal. And
Right.
so this would be the first go-to. And then obviously, as we get to know you and, you start to better understand all of this, we might recommend other testing because, food sensitivity testing does go hand in hand because you can work and clean up your digestive tract, your gut all day long. But at the same time, if you're eating foods that are causing massive inflammation, it just kind of slows the progress,
Right.
So that's just a snapshot of like specialty testing, going deeper into that. But I'm going to just talk about our VIP program because this kind of brings in all of the different components. And this program is not for someone who comes to us and says, I'm super healthy. I have 15 pounds to lose for a wedding in 3 months. You know what I mean? This is really for someone who understands that not only they have a lot of weight to lose, so say like 25 pounds or more to lose, but they, exactly like you were saying, that there's something else going on that's holding you back. So it's all about really looking at the root. So so this particular program is a 3-month program. And so you're basically taken through different phases. I'm actually going to go, I don't like to go through that one first. I like to kind of go through this one first. So you can see here, it's 4 key phases. And so the first 2 weeks of our VIP 3 program, you're really learning about healthy foods. You're learning about inflammatory foods, the foods that need to be eliminated during this process. The second phase is 4 weeks long, and that's our accelerated weight loss phase. So you're doing one of our signature weight loss programs. And then the third phase is digging deeper. So this is when we would do some testing. And then once we get the results, we're working with you on those results of obviously strategically creating, treatment protocols for that. And then the last couple weeks is kind of pulling everything together, looking at, what your original goals were, where you are now, and how can we start to create a long-term plan for you. So there's quite a bit that's included. You can see here that one of our 4-week weight loss programs is included. You get 10 visits with one of our providers. So that's either a dietitian, a nurse practitioner, or our integrative practitioner.
Okay.
Visits can be virtual or on site. Included is one of our specialty testing. You do get one of our package of one of our vitamin injections, 5 vitamin injections. And then we do send you home with an integrated scale. And essentially what that means is the scale that we send you integrates with our app. So we can see everything that you're logging when you get on the scale. We can see it, on the weeks that you're not coming in and that type of thing. So it's really nice. All of our programs are all within an app as well. So you're getting fully supported with that along the way.
Okay.
So I'm going to just stop there because I just kind of went through a lot and ask if that made sense or if you had any questions about that.
I think that program would be great for me. The only thing, like I said, I'm concerned about is my binge eating, I guess, knowing when to stop and I don't know, be full enough that I don't overeat.
Yeah.
So what kind of options are for that?
Well, it's really going back to digging deeper into the reason why you have it. And it could be a number of different things. It could be some type of psychological, some type of thing that happened in your upbringing that it's more of a mental thing. Oftentimes it's a gut thing. When you have gut issues, you have extreme imbalances of certain organisms in your gut. And the one that causes the most sugar cravings is yeast and fungus. And we see it over and over. The people that crave sugar the most have overgrowth of yeast. So once it is all about looking into the stuff because then we're able to actually treat and address it. But just by answering that right now, it could be multiple things,
Okay. Okay. Yeah, I think this is a really great program. I think this is what would be perfect for me.
Okay, so I'm going to go over the pricing, which I have up here now, and then we can kind of just go from there. So if you pay in full, it's $19.50. If you want to pay monthly, you can do $700 a month for 3 months. If for some reason this doesn't work for you, we work with people kind of creating all different plans, but these seem to be the most common. HSA, if you do have insurance health spending account, you can use that for any of our programs. And so that's pretty much it.
So you said HSA, but this isn't covered by insurance or anything, right? Insurance wouldn't cover anything?
Well, we don't contract with insurance companies, but that doesn't, what that means is that we don't accept assignment for it. That doesn't mean that your insurance company wouldn't cover it. So what you would do is you would call your insurance company and ask them if they cover these type of services. And we can send you a sheet that helps you with that conversation of our services.
Okay.
And if they say, yes, we will reimburse X amount, then what happens at we can provide you with what's called a super bill. You submit to them and then they reimburse you the money. That's kind of how it works.
Okay.
And we give you a very it's a legal kind of document with all the codes, the ICD, CPT codes and everything. So literally all you have to do is submit to them and then they reimburse you. So they don't, when I say we don't contract with them, if we did, they would reimburse us, you know, rather than you.
Okay. I do have a question. So if somebody were or with people starting on this program, I guess, what is the success rate with them? I guess changing their eating habits, figuring out their problems and reducing weight?
I mean, it's significant, you know, everybody is getting all of it. I mean, when you start to dig deeper into the people are, I mean, you know, and I always say this, but we're trying to pull all of our VIPs together because they never thought they could feel good again, you know? And when they see it happen so quickly, it's like, it's amazing. So yes, I mean, they are all losing weight. They are all feeling better. I guess what I can't answer right now is like the exact amount of weight that they've lost. And we also, you know, there's some that stick with us and do our maintenance plans, but some, they finish the program and they're done. So we don't know exactly where they're at now, you know, so there is some unknowns, but it really, people have so much success with this program. We've been doing this program for like, you know, it's almost as long as we've been open.
Okay. All right.
Years, but it's really been like years we've been doing this. And then, so I kind of went through what's all included there, but if for some reason, I guess, do you want me to kind of give you an idea of what our weight loss programs look like? Because one of these is also included in the VIP, or you have the option to do any of these a la carte. You know, you can just do a weight loss program if you wish to do that.
Sure. Yeah, you can explain these.
Okay. So these are kind of like our signature weight loss programs. They are quick, they are super effective, and they are what we refer to as strategic because they're doing something in the body that does not happen by just lowering your calories. And it's so important to understand that concept because we are lowering your calories, and we're lowering your calories because we have to create a calorie deficit in order for your body to use its own abnormal fat stores for the remaining calories. The whole goal of our programs is to access the kind of what we call like the trapped fat, the inflammatory fat that literally just stays there and never moves with diet. So all three of them are specialized low calorie. They promote significant fat loss. They preserve muscle mass. You come in for weekly visits for the accountability piece. And all of our programs can also be done 100% online. Now,
Okay.
the diet for all three of these programs are the same. What is different is the products that are used to produce the weight loss. And so I'll just give you kind of an idea of what the main differences are between these three. But I think, did you did HCG before?
I have not done that before.
Okay, that must have been somebody else then. So HCG stands for human chorionic gonadotropin. It's like a protein hormone that has been used for weight loss for like almost 100 years. Recently, the FDA banned the use of injections, or they really significantly minimized our use of it for, you know, I won't get into that, but essentially we had to kind of switch to we had to switch to an alternative. So now we provide HCG by drops. So it's like you're doing drops 3 times a day before meals. And this is what's really accelerating the fat loss along with the specific diet. So this one you're doing, you know, drops. This particular program you would be doing, it's called HC2. You're doing like taking 3 different products. And so again, it's 3 different products versus 1. So that's kind of, you know, some people consider that to be a significant difference. But what this one does is really supports the detoxification pathways during weight loss. And this is so important because our toxins, all of our toxins, well, I shouldn't say all of them, but the majority of toxins that are in our body are stored in our fat cells. And that's why it's difficult to burn what we call the abnormal fat, because the body is smart, right? So the body's going to put it in an area, it's full of inflammatory toxins, and it will not allow it to be released. But we obviously, our programs are designed to get those stores to be released. And then this particular program will support the detoxification once it is released. So we recommend the HC2 program for people who they either know they have liver issues, maybe they did blood work and the doctor's like, you have elevated liver enzymes, or, you're starting to develop fatty liver, that's an automatic, we have to support the liver pathways. And it's also, then we're also supporting electrolytes, because with quick weight loss, you are going to flush a lot of water, and with that goes electrolytes. So it's a well-rounded approach to the quick weight loss.
Right. Okay.
And I didn't really talk about this, but with all of our programs, you're getting a comprehensive body composition assessment. You're coming in weekly for, meeting with our dietitians. And then at the end of every program, we do a final results and strategy session, and then we bring you back 30 days later to do another body composition assessment, just to make sure you're on track and doing, trending in the right direction. And then HCA lean, again, for quick weight loss, these are the three products there, disappeared. But this is more for people that are heavy exercisers and really feel the need to maintain that really high level of intensity while losing weight. Because on these two, we're not really focusing a lot on exercise. We definitely want you to move and be active, but we're not like having you go to the gym for like an hour, 2 hours, or anything like that. And it's actually counterproductive to do that too. So this is really for those who are like, I literally have to exercise, otherwise I can't, stay focused in that.
Right.
So that's just our weight loss programs that, so one of those is included in the VIP. And then, so I think that's pretty much the core.
Okay.
Any questions? What are your thoughts on all of it?